Hi, this is Dr. Pallavi Prathivadi, one of the GP registrars at Berwick Healthcare. We're just continuing our series of educational videos for you guys to watch, and I'm going to spend a few minutes today talking about preventative health. When we say preventative health, it really means what can we do to prevent disease or prevent worsening disease. For example, how can we control your blood pressure and your cholesterol now so that you don't end up having a heart attack in the future? And the way preventative health works is that we do a lot of studies all over the world with thousands or millions of people, and we say if you do all of these things, then you're really at low risk of developing these complications. And then we make recommendations to all of our patients. So what I'm going to do in this video is break it up kind of into people in their 20s, 30s, 40s, 50s and older, what we really recommend based on medical studies and evidence for your preventative health. So firstly, in terms of people in their 20s, obviously we want to make sure that you are up to date with all of your immunizations, and that women under the age of 30, most women will be getting a urine test or a genital swab for chlamydia as part of routine STI screening. We would like you to make sure you're drinking safe amounts of alcohol. What we recommend is at least 2 days a week with no alcohol at all. And if you are going to drink on a day, that you have no more than 2 standard drinks if you're a man, or usually 1 standard drink if you're a woman. The other thing is we would prefer that you don't smoke. What we recommend is 0 smoking at all, and obviously these things go for every age group. If you are a smoker, then we would strongly suggest really think about cutting down. It's probably one of the best things you could do for your health, or come and talk to us about it if you're open and ready to think about quitting. And obviously diet and exercise. So our recommendations for exercise are at least 5 days a week, 30 minutes of moderate intensity exercise, which means that if you are walking or running, that you're doing it at a pace fast enough that you can't chat on the phone. So you need to be fairly out of breath. We have no care whether it's running, walking, swimming, dancing, it doesn't matter. You just have to find the thing that works for you, that you enjoy and you can commit to 5 days a week. That of course also goes for every age group. And nutrition. So nutrition is obviously a much bigger discussion, but healthy eating is really quite important for good health. And the best way you can get more information about healthy eating is if you look on websites like the Heart Foundation or patient.co.uk or the Better Health channel. And there are really good recommendations for the amount of dairy that you need a day, protein, good amounts of fruits and vegetables. What we generally recommend is something called a Mediterranean diet, which means low amounts of meat, really high amounts of grains, seeds, nuts, fruits and vegetables. We found in all of our studies that that's the kind of diet that really reduces your risk of heart attack, stroke, cardiovascular disease. And then we move on to people in their 30s. Actually, this probably applies to women in their 20s as well, where there's a big focus on healthy pregnancy and maintaining a healthy weight for lowering the risk of diabetes, but also to reduce your risk of obstetric complications. And nowadays, we've got luxuries of lots and lots of different types of genetic screening and testing before and while you are pregnant. So if you are looking to conceive or you're in the early stages of your pregnancy, maybe come and talk to one of us about all the specific kinds of tests. If you are overdue for a tetanus vaccine, and particularly if you work in areas where you are at much higher risk of injuries from rusty nails is the classic, or dodgy metal, then make sure you are up to date with your tetanus vaccine. Often people in their 30s start coming into medical problems, asthma, high blood pressure, diabetes. So if you do have any of those conditions, you will need to come and see us usually every 3 months so that we can keep on track with your ongoing monitoring and care. Coming up into the 40s is when we really start pushing for preventative health. So for men and women from the age of 45, we start doing something called calculating your cardiovascular risk. which is essentially we do a test of your cholesterol levels, we do an ECG, we test your blood pressure, and we kind of put all of the information together, and we give you a risk of how likely you are to have a heart attack or a stroke in the next 5 years. And you should probably be having one of those done every couple of years. Very easy for us to do. Under the age of 45, we don't necessarily calculate that risk, but if you are worried or you think you've got a family history, then obviously it's something that we can do. The other thing is starting from the age of 40 or 18 if you're at high risk background, or you're of Aboriginal or Torres Strait Islander origin, we would also start screening you for diabetes, which means that you come in, we ask you a whole lot of questions about your family history, we kind of understand how high a risk you are, and then either we will measure your waist circumference and see if you're carrying a little extra weight, or other stuff to do a blood test to screen you for diabetes, and that should usually be done every couple of years as well. Then when you start moving up into the 50s, that's when we start to screen for cancers. So you might, if you're over the age of 50, you might remember getting a poo test from the government in your mail, and that it gets sent out every couple of years from the age of 50. Essentially what you do is you collect your poo, it's super glamorous, and the lab analyzes it for blood. Blood in the poo that we can see under a microscope sometimes is a sign that there's a little tumor or something in the gut that's bleeding. So it's part of our routine screening for colorectal cancer. From the age of 50, we also are doing regular mammograms, which should be every 2 years, and then what we're really looking for is very, very early changes of a breast cancer. The idea with screening for cancers is that we want to catch things incredibly early, before they have symptoms, before they're causing problems, so that we have the best chance of actually treating them successfully. I forgot to mention, the other cancer screening that we do, of course, which is pap smears. And you might know that we completely changed the way we screen for pap smears. It used to be women who are sexually active. We would start from the age of 18. We are now screening women who are sexually active at any time from the age of 25. And we do a swab of the cervix every 5 years if you're low risk. Of course, if you do end up getting a high risk result, the 5-year rule won't apply to you. You'll be on a 1 or a 2-year program usually. That was for women starting in their 20s. And then as we start moving into the 60s, we start talking about immunizations again, in addition to all of the other stuff I've mentioned. If you're 65 with chronic diseases, there are certain vaccines that we give you for free. Also the annual flu vaccine, which if you've got any sort of chronic condition, asthma, diabetes, lung problems, any issues with your immune system where if you're at risk of getting influenza, you're likely to get a really nasty form of it, you should be getting an influenza injection every 12 months. And the reason why you need it every year is because we change the strains of it every year. And then of course, as you start coming up into your 70s and 80s, we start to make sure that you are low risk of having really nasty problems that will end up in hospital, that you are enjoying your quality of life. We want to make sure you're not at a risk of falls, that your hearing is okay, that your eyesight is okay. Obviously, if you are 75 or older, we would do this through the 75-year-old health check, which is a really terrific half an hour to 45-minute head-to-toe check of you, which is usually done by a practice nurse and a doctor, to make sure that that you are doing really well for your age, and if you've got any problems, we are putting in resources and doing everything we can to help you address it, maximize your quality of life. Obviously, this is just a bit of a summary, and depending on your family history or your personal circumstances, we would add in other stuff. Also at every age, we would make sure that we're talking to you about well-being, mental health, that you are not struggling with issues of alcohol dependence or any other drug and alcohol issues. I guess what I'd like to do as I finish up is really say, although a lot of these things are awkward to talk about, we're on your side as doctors. We just want you to have really a good, healthy life. And if you've got medical conditions, to keep them as well controlled as possible. We don't want you in and out of hospital or having a hard time with sick relatives, which is the reason why we really push for preventative health, and we want you to know about what you can do, what we can do to try and make life easier and healthier for you. That's it. Obviously, if you've got any questions, please leave them in our comment box, and Chelsea, who's filming this, will address them. Otherwise, come and see us and have a good day.